It's my absolute pleasure to be invited to launch the Pride at Home report. My sincere thanks to Dr. Mel Duffy, Claire Mooney, Dr. Giovanni Ferezzo, Professor Anthony Staines, Professor Anne Matthews, James Geoghegan, Colette Gleeson, James O'Hagan, and Sean Vale. The population over 65 in Ireland is estimated to have risen by over 40% between 2013 and 2023. In 2024, the Central Statistics Office estimated that there are 833,200 people over the age of 65 in Ireland, but they offered no data as to the LGBTI population. The approximate range of the LGBTI population is thought to be between 5 and 7%. And if we apply this estimation to the total estimated population of those over 65, we're talking about between 50,000 and 58,000 people in the LGBTI population and community. Older LGBTI people live with the memory of discrimination throughout their lives, particularly any form of discrimination or prejudices that they received while in healthcare. It's well documented how past experiences inform current situations, making many older LGBTI people very wary. Many older LGBTI live with the memory of being immoral, criminal, and being in need of psychiatric intervention. Remember, homosexuality was only decriminalised in Ireland in 1993. Paired with the risk of being arrested because you were not heterosexual, LGBTI people were seen in healthcare as needing fixing, and this rendered them in need of psychiatric care. The model that older LGBTI people grew up with was therefore threefold: a sin, immoral; a crime, criminalisation; and an illness or disease needing psychiatric intervention. Medical treatments became the new form of punishment and social control, so that the medical profession became influential in defining identity and sexuality, which in turn permeated into cultural norms. This is the history of many of our older LGBTI family members and many of your clients. Coming out is a precarious affair, whereby LGBTI people usually choose when, where, and to whom they can relate their sexuality. It involves making decisions on whether to disclose or not disclose based on whether it's safe to do so, resulting in the process of being fraught with the unexpected, from social acceptability to rejection. Coming out is not a singular activity, but it requires indicating one's sexuality time and time again. Now consider your home. Someone arrives at your door and you're at your most vulnerable as a stranger enters to carry out the most intimate of care. Remember, past experiences form your thoughts on how this interaction will go. How do you feel? I would suggest you feel fear, anxiety, never mind the normal anxiety of a stranger touching you and you being seen at your most vulnerable. The fear of rejection as a human being and of being treated differently. What does that feel like? And so let's talk of pride at home. 88% of healthcare professionals who were surveyed reported no education or training in dealing with the community. 33%, in fact, were not aware if they had experienced interaction with LGBTI community. So the study aims were threefold. One, to identify the home care experiences of the community and their support circle, and they did that through interview. Two, to uncover the knowledge and attitudes of professional caregivers providing home care services to the community dwelling older LGBT people and their support circle, and that was done through a survey. And finally, to co-develop an educational toolkit that would lead to improved practice and quality of home care services received by community dwelling older LGBTI people. This is the first education program of its kind nationally and in fact internationally. There's been nothing like this before. So the hope is that this can be an inspiration for the creation of other resources in other contexts in the shared purpose of improving the inclusiveness of care services destined for sexual minority groups, so that they are treated as everyone else and at the same time recognized as individuals with a distinctive set of needs that includes awareness and consideration of their histories of invisibility and inequality. Pride at Home was developed to enable those working with sexual minorities to care without discrimination or preconceived ideas about LGBTI people. Those who undertake the program will learn to practice from a human rights, open-minded framework, thus embracing the person they meet in their own home. And their logo speaks to this with the caring hands embracing the rainbow home. So a few tips. Always do math history and fit the age of your client within a larger framework. Remember that anyone who is age 50 or older has spent some part of their adult life fearing that their sexual orientation could get them into trouble. Outlawed, pathologized by medical professionals, and also living within a spiritual alienation, and in some cases, in fear of abandonment or having experienced abandonment by family. Show kindness and provide reassurance through your words and behavior that you are aware of this and that you empathize with them. Not for being a member of the LGBT community, but for having to survive the minority stress within a society which was historically unaccepting and at times cruel towards them. Finally, please, show openness, be mindful of history, be prepared to listen, develop your emotional skills. Avoid assumptions and stereotypes. Use inclusive language. Acknowledge and respect pronouns. And perhaps ensure representation by having a rainbow lanyard or a badge visible for LGBTI people so they can see that and that will allow them to absorb the support of your organization and of your individual key support people. Thank you for listening.